What is the process like from the patient side of, you tell me that I need an implant and now I have the finished done implant?
Okay, so what you would do is you'd come in the office, we take the appropriate x-rays, we figure out what we need for an implant. So the day of the implant, people think it's going to be uncomfortable because you're drilling into my bone. But it's funny, I use less anesthesia when I do an implant than when I do a root canal, because all you're doing really is manipulating the tissue above the bone. Drilling into the bone is, the patient really doesn't feel that. They may feel the vibration, but there's no pain associated with that. In 3 to 5 months, the implant is totally, hopefully, integrated. There's like a 90% chance of success. And you have to pick and choose your patients, because sometimes people with diabetes that's out of control, they don't heal well. If a patient is a controlled diabetic, yes, you can do implants. Smokers, heavy smokers, it just makes things a lot harder. Can affect the healing process, and sometimes it just doesn't work with heavy smokers. But it's amazing that I'm like screwing in a tooth in somebody's head.
Now compared to dentures, that's like solidly in place, so I can eat all the things that I would want to eat, right?
Right. It's you're chewing with the same forces that you would chew if you had your own teeth. People don't understand. Just take my teeth out. But when you lose your teeth and you have dentures, it's sitting on soft tissue, and you can't even develop anywhere near the forces you can develop with your natural teeth, or with what they call implant supported prosthesis. And usually on the top, having a denture is not so bad because you have good suction. On the bottom, you're not going to get that. Bottom dentures are a nightmare. I never forget, we were driving back from dental school, and I'm looking next door, and I see this guy sneeze, and I see his dentures come out.
Oh my God.
So now what you can do is you could put in 2 implants on the lower, and they could take it out, but it's not going to flop around. It stays in one place. I mean, it moves a little bit, but it stays in their mouth.